Just one little pill that can kill pain or kill your liver. It's cheap, it's everywhere, and millions take it without thinking. But how safe is paracetamol really? Hey everyone, if you are new to this channel, I am Master Degree Pharmacist from Bulgaria, joined to create topics related to drugs, pharmacology, and medicine. First, let's start with the basics. What actually is paracetamol? Well, it's a common painkiller and fever reducer that's available over the counter. Yep, it's that active ingredient in those pills you pop when you have a headache or a fever. In the US, it is known as Acetaminophen, but worldwide, it goes by names like Efferalgan or Panadol. But here's the key. It does not reduce inflammation, unlike ibuprofen or aspirin. So if you're dealing with swelling, paracetamol may not be your best option. Have you ever used paracetamol for inflammation? Leave your comments in this video. I am going to put some links in the description with more detailed, useful tips about paracetamol. Here's how it works. When you're in pain, your body releases chemicals called prostaglandins. These chemicals send pain signals to your brain. Paracetamol blocks the enzyme that helps make prostaglandins, but only in the brain and spinal cord, so it doesn't work where the pain starts. It just turns down the volume in your brain. Sounds pretty useful, right? But here is where it gets tricky, because the line between safe and dangerous is thinner than you think. Now let's talk safety. For adults, the standard dose is 500 to 1,000 milligrams every 4 to 6 hours. Never exceed 4,000 milligrams in 24 hours. You can take up to maximum 8 tablets in 24 hours. And here, there is another bonus tip for you. General guidelines for paracetamol dosage in children says always use the dosing device provided with the medicine. And consult a healthcare provider when in doubt. Oral dosage, liquid or tablet, standard dose, 10 to 15 milligrams per kilogram of body weight every 4 to 6 hours as needed. Maximum, 4 doses in 24 hours. I have attached a great table for your convenience about example doses by age and weight for children. I'll give you one more useful tip: paracetamol usage in pregnancy. Paracetamol is considered as a first-choice painkiller and fever reducer during pregnancy. It is preferred over NSAIDs like ibuprofen, which can carry risks in certain stages of pregnancy. Paracetamol has been widely used by pregnant women for decades, with no proven risk of birth defects when taken responsibly. But here's the dangerous part. Many combination medicines, like cold and flu remedies, also contain paracetamol. So if you're not checking the labels, you might be double dosing without realizing it. Think about it and try to remember if you've ever been in this situation before. Now let's talk about what happens when you take too much or overdose, so to say. Taking too much paracetamol can cause serious damage to your liver. Here's a quick look at your liver and how it gets damaged when you overdose on paracetamol. We've taken a healthy liver and put it under a microscope so you can see what it looks like. When you take too much paracetamol, it gets broken down into a toxic substance that harms the liver cells. This can cause inflammation of the liver, and if it's not treated, it can lead to liver failure. In fact, paracetamol is one of the most common causes of liver failure in the world. Symptoms of an overdose include nausea, vomiting, stomach pain, sweating, and loss of appetite. If you think you've taken too much, you should seek help immediately. Ever heard of N-acetylcysteine? Here's the scoop. N-acetylcysteine is the antidote for paracetamol overdose, and it's highly effective if given early. Here's a clear breakdown of how and why it's used. A toxic metabolite called NAPQI accumulates and begins to destroy liver cells. NOC works by replenishing glutathione, a molecule that neutralizes NAPQI. Scary? Yes. But preventable? Absolutely. Here's how to use paracetamol safely, without putting your health at risk. First, always read the label, even if you've taken the medication before. Never mix it with alcohol. It may seem harmless, but it can cause serious damage to your liver. Second, don't mix it with other meds containing paracetamol. Double dipping, that's taking more than the recommended dose, can be deadly. So remember, it's safe when smart, but deadly if you double dip. I hope you learned something new today. If you enjoyed this, hit like and subscribe for more health tips. And if you want to learn more about medications, check out my video where I compare paracetamol to ibuprofen. I'll see you there. Stay safe and stay informed.